morning. Thanks for joining us today. My name is Tony. I'm the Media Relations Specialist here at Essentia Health. We are hosting this press conference in conjunction with St. Luke's to update the impact of COVID-19 and the impact it's having on our communities and hospitals and how people get help. Speakers from Essentia Health today include Dr. Ann Stephen, our East Market Chief Medical Officer, and Dr. Christina Baston de Jong, a critical care specialist. And then from St. Luke's, we have Dr. Nick Van Deelen, the co-president and CEO and chief medical officer, and then Dr. Jonathan Schultz, an emergency medicine physician. We'll be talking about the importance of vaccinations, masking, the impact COVID is having on our emergency departments and ICUs, and how the public can help reduce the strain on our communities. Each speaker is going to have about 5 minutes worth of remarks. That will be followed by a short Q&A with reporters. Questions can be asked via the raise your hand function in Zoom, and then waiting to be called on or by submitting them with the Q&A feature in the chat. When you are in the meeting, you will see the Q&A button at the bottom of your screen. We'll do our best to answer as many questions as possible. If you are called on to ask a question, please say your name, the media outlet you're with, and to whom your question is directed. That would also double if you're using the chat function to ask your question. So with that, I will turn it over to Dr. Ann Stephen. Go ahead, Dr. Stephen.
Thank you very much. Welcome, everyone, and thanks for joining us. I'm Dr. Ann Stephen, a pediatrician and the Chief Medical Officer here at Essentia Health East. Today, my colleagues and I have some sobering news to share as we confront aggressive spread of COVID-19. I expect that we'll have a rather candid conversation around the impact of the surge and the strain it's placing on our healthcare resources. You deserve to know where we're at and how critical the situation has become. I'll start with some numbers. Across Essentia Health, we have 129 patients hospitalized with COVID-19. Of those, nearly half, 59 of them, are hospitalized here at St. Mary's Hospital in Duluth. This is the highest census of COVID patients we've had at St. Mary's since last winter. Regionally, we're part of a group that we refer to as the C4, which stands for Critical Care Coordination Center. Among the functions of the C4 are to monitor ICU bed availability and to assist hospitals in finding open beds across the state. Recently, that's become a challenge because there just aren't beds available. And when patients have to be transported well beyond our region for care, that's scary, especially when time is critical. One more number that highlights the severity of the situation. One day earlier this month, we had 7 ambulances arrive simultaneously at the emergency department here at St. Mary's. While much of the country experiences a decrease in COVID transmission following the latest peak, there's more uncertainty here in St. Louis County. We're regularly adding more than 100, sometimes close to 200 new cases every day, and we haven't witnessed numbers that high since last December. You've likely heard that one of the consequences of the pandemic, and one we're combating right now, is that many people delayed care for chronic conditions like hypertension and diabetes. As a result, they now need a higher level of care. They need more resources. Combined with COVID, this is leading to unsustainable hospital volumes. So we need your help once again. Getting vaccinated is the safest and surest defense against COVID. If you don't want to get vaccinated for yourself, do it to protect a vulnerable friend who has a compromised immune system, a child who's not eligible for vaccination. Please don't let politics guide your decision-making about getting the vaccine. Let science and medicine guide your decision-making. Again, getting vaccinated is the safest and surest defense against COVID. As a pediatrician, it's been troubling to see this latest spike's impact on young people. We often hear that it's now a pandemic of the unvaccinated, and that unfortunately includes children. In addition to daily calls statewide about hospital bed availability for adults, we now have set up, unfortunately had to set up, a statewide bed availability call for children. Besides getting vaccinated, I would encourage you to continue wearing a mask even though it's not mandated by the state. It's an easy thing to do and it's effective in preventing the spread of the virus. When you don't know people's vaccination or COVID positive status, you can have someone who's COVID positive without symptoms and they don't know it either. How else can you help? Receive your flu vaccine to ease the strain on healthcare resources. Stay home if you're sick and get tested for COVID if you have symptoms. At Essentia, and I know the same is true of St. Luke's and other health systems, we're doing everything we can to keep our patients and communities safe. That includes requiring COVID and flu vaccination as a condition of employment, restricting visitors in our hospitals to decrease the risk of COVID transmission, and collaborating with partners like C4 to try to keep up with demand for beds. But we're approaching a tipping point, and we need your help to overcome it. Thank you.
Thank you, Dr. Stephen. Next up, we'll have Dr. Jonathan Schultz, an emergency medicine physician at St. Luke's. Dr. Schultz, go ahead.
Hi, thank you for having me. My name is Jonathan Schultz. I'm an emergency medicine physician here at St. Luke's. I've been here at St. Luke's for about 13 years, and I've been in healthcare for just shy of 20 years in total. You know, in that time, we've had different spikes of patients for various reasons in the ER, but we are currently really seeing unprecedented volumes within the emergency department, seeing very high volumes and persistently high volumes day and night in both our ER and up at Essentia. This is causing a number of problems in terms of being able to get ambulances in terms of having enough ambulances for all the calls that are coming in, and then the system backing up in terms of trying to get patients into the hospital. You know, statewide, there's about 960 patients currently in ICUs with COVID-19. This accounts for just over 30% of all ICU patients. And so this extra volume of patients in a system that runs full at baseline is really causing unprecedented strain. And in the ER, we're seeing a lot of those patients as well. I don't know the exact percentage of COVID patients in the ER, but it is an increasing volume and is causing us to really have difficulties with seeing and moving patients. In addition to that, however, there are a number of patients who are coming in with urgent and emergent conditions that likely could have been prevented had they received some of their routine care earlier. So for example, just recently, this past week, I admitted a patient in congestive heart failure who required hospitalization, and had that patient come in earlier with their symptoms that likely could have been managed on an outpatient basis. They specifically stated that they were concerned about coming into the emergency department, specifically out of concern of being exposed to patients with COVID-19. And so there are patients who are delaying their care at their own risk, and then waiting until they're so ill to present to the emergency department that they require hospitalization at that point. And that further stresses our system. You know, we are finding kind of innovative ways to take care of these patients. We have a new 38-bed ER, and we've expanded to use most of those rooms so that when our ICUs are full, we'll maintain and manage those patients in the emergency department until a bed becomes available upstairs. This is called boarding in the emergency department, and it's being done statewide and is an increasing problem as ERs are filling up with patients that are having difficulty getting upstairs. We're doing additional things as well. We are finding ways to bring patients in from outlying smaller facilities when they have a patient that they're not able to transfer. When our hospital is full and Essentia is full, this causes kind of a backup throughout the system where patients are being held at smaller hospitals due to an inability of a bed at one of the larger tertiary care facilities. And again, this is a statewide problem in the Northland. But we're finding innovative ways to help our outlying hospitals. We're transferring patients in to St. Luke's here to do emergent procedures on those patients. And then if we don't have a bed available, once those patients are stabilized, they can transfer back to their outlying hospital for the remainder of their care. In fact, just recently, we brought a patient in who required an emergent procedure on their kidneys, where they weren't able to find an accepting facility for that patient. We brought them here, performed a procedure on the patient's kidneys, and then they went back to their home hospital for continuation of care. And that likely saved that patient's kidneys and probably kept them off dialysis. So we're finding innovative ways to manage patients despite being full. As was already said, you know, I certainly would echo patients to get vaccinated. All people need to get vaccinated. This crisis that we're in right now, and it truly is a crisis, is really particularly unfortunate given that it's an avoidable crisis. Really, much of what we're seeing right now could have been avoided with higher vaccination rates when those vaccines first became available, because it is true that what we're seeing right now is really an epidemic of the unvaccinated. Those patients who have been vaccinated, some of them are getting COVID, but very, very few of those patients are requiring hospitalization. So getting vaccinated is one of the most important things that patients can do. Additionally, I'd like to encourage all patients, if they have an urgent or emergent condition, that they really should present to an emergency department. That is what we're there for. And both hospitals in town are set up and capable of continuing to handle emergent cases. So please don't delay care, because that almost always leads to bigger problems further down the line. That being said, however, it is important to understand the unprecedented pressure that our hospitals and our emergency departments are facing right now. And those conditions that really don't require care in an emergency department, those kind of cases really should be seen by a primary care physician in clinic or in an urgent care setting if needed. Things like the common cold and cases like that, abrasions and small lacerations, those kinds of things can be managed in settings other than an emergency department. And then along those lines, routine testing for COVID-19, presenting to an emergency department for that is not appropriate for like return to work or return to school testing. There are a number of facilities in our region that are set up to manage that kind of testing. The DEC has expanded their hours for their COVID testing. Local pharmacies in town can do that testing. And those resources are available on our website at St. Luke's with a listing of where you can receive outpatient COVID testing. So those kinds of things, if possible, should avoid being seen in the ER. But again, very, very important to understand that urgent and emergent cases should present to the ER, and we are ready, capable, and certainly willing to care for those patients. I believe that Dr. Bastian DeYoung has kind of some input from the Essentia side, if that's who's next, from the ICU side.
Thank you, Dr. Schultz. Yeah, we can turn it over to Dr. Christina Bastian DeYoung, a critical care specialist who works in our ICU. Go ahead, Dr. Bastian DeYoung.
Hello, my name is Dr. Christina Bastian DeYoung. I work in the ICU at Essentia Health here in Duluth. First, I would like to thank Northlanders who have worked tirelessly over the last couple of years to help end this pandemic. Your efforts have not gone unnoticed by many people, including those of us that work in healthcare. For the last 18 months or so, we have been inundated with both COVID and non-COVID patients. Here, in the midst of yet another surge, things are similar to previous surges. What is different, however, is that now we have a tool to lower the number of patients in our ICUs and reduce the strain on our hospital systems around the state. That tool is vaccinations. If you haven't been vaccinated, I urge you to please consider doing so. If you are unsure of the vaccine, make an appointment with your healthcare provider and have a one-on-one conversation with them about the vaccine and the benefits it provides. Currently, about 25% of our ICU beds here at Essentia are filled with patients who have COVID-19, most of whom are not vaccinated. The ones that are vaccinated are elderly or have underlying health conditions. Right now, we're seeing a much younger, unvaccinated population impacted by COVID who end up on life support machines. Unfortunately, a lot of this is caused by the highly transmissible Delta variant, which, as I have seen firsthand, is more likely to impact younger, healthier people, including children and pregnant women. In September alone, nationwide, weekly pediatric cases rose 240% from what we were seeing in July. We expect that trend to continue with school in full swing. It's not just COVID patients, however. We are seeing a high volume of non-COVID patients as well. Some patients are sicker because they delayed their care during our prior surges. There's an increase in people presenting with heart attacks and strokes, which can also be caused by COVID. We are also seeing patients with healthcare needs due to stress, depression, and substance abuse. All of these have become more widespread now than they were prior to the pandemic. The bottom line is so many of our beds are filled with patients who are eligible for vaccination but have not received one. One of the most common things we hear from these patients is, I wish I would have gotten the vaccine. Caring for these patients is compounded by a workforce shortage that is impacting not just Essentia, but all of the health systems around the country. This is causing them to divert patients to locations and sometimes cases with great distances. We have received patients from south of the cities, west central Minnesota, and have had to send patients to these areas also due to ICU bed shortages. This has resulted in a moral dilemma for me and many of the dedicated healthcare workers I have the privilege to work alongside. We know how important it is to be close to family and friends when we receive critical and oftentimes life-saving care. Nobody wants to be hospitalized ever, especially if they have to be sent to a hospital system that is far away from family and friends. While it gets more and more difficult to provide care for our patients due to limited bed capacity, staffing shortages, and an influx of patients, we are here for the community. We will find beds, we will find a way to get you the care you need, and we will work our hardest to make sure you have a positive outcome. There are a few ways people can make that easier on their healthcare systems, and that's why I'm speaking to you today, to make a plea to do everything you can so that your friends, your neighbors, and your fellow Northlanders are able to receive the care they need right here in the communities that they live and work in. First, if you're not vaccinated, we strongly encourage you to do so. Start that conversation with your trusted family doctor. They've always had your best interest in mind throughout a lifetime of care, and they will continue to have your best interest at heart when having a conversation about the vaccine. Second, mask up. Yes, even if you're vaccinated, and especially if you're indoors. I know many mask requirements, be it at the local or state level, have been removed. However, that doesn't mean they're no longer effective. Studies have shown that they greatly reduce the spread of the virus, and that remains true today. So if you're at the grocery store, put one on. If you're spending an hour or two at church on Sunday morning, please wear one. If you just have to run into a coffee shop, throw a mask on. It might prevent you or someone else from getting sick. I can tell you firsthand, one fewer person in our ICU makes a big difference right now. Third, don't delay your healthcare. By putting off healthcare, you run the risk of being sicker when we see you and then needing to come into the hospital. So if you need preventative care for things like diabetes or hypertension, we want to see you in the clinic. I, along with every other healthcare provider at Essentia, have made it my life's work to care for you. That remains no different today. Whether it's seasonal flu, a sports injury, or battling through a pandemic, we are committed to helping our community and staying healthy. But we can't do that alone. So please, we need your help to put an end to this. Please follow my recommendations. I want to end this just as much as you, but we all need to pitch in for this to succeed. Thank you.
Thank you, Dr. Baskin de Jong. Next up, we have Dr. Nick Van Deelen, co-president and CEO, as well as chief medical officer at St. Luke's. Go ahead, Dr. Nick Van Deelen.
Thanks, Tony. Well, what I'm going to say is really a repetition, I think, but probably important to repeat. You know, like Dr. Baskin de Jong and Dr. Stevens spoke to, St. Luke's is experiencing extremely high inpatient and emergency department volumes. Our St. Luke's team has been working extremely hard to meet this high demand, and I'm so proud of the work that they're doing. We've been humbled by how our employees are stepping up to help in so many ways. They're truly living St. Luke's values of teamwork, compassion, quality, and safety. And I'm so grateful to be able to work with such amazing people. We are confident that we'll continue to be able to provide safe and effective care to all of our patients, but we may need to make some adjustments in order to achieve this. For example, last week we did postpone a small number of elective cases, surgical cases, those that required an overnight stay. We know this is a big deal for those patients when their surgeries are postponed, and we deeply appreciate their understanding. And we'll get them rescheduled as soon as possible, some even this week. We're happy to report that we have not had to cancel any additional surgeries, and we were able to do all surgeries where patients can be discharged home that same day. We hope we won't need to do this anymore, but again, we are managing this really on a day-to-day basis. We're committed to using our resources effectively in order to provide the best care that we can for this region. I'd also like to highlight a few factors that are contributing to our increased inpatient volumes. As already has been said, we continue to see the impact of patients who've delayed care during the pandemic. They're now coming in sicker than they would have been if they sought care when they had their first symptoms. So again, don't delay your care. Please seek out care when you feel you need it. We are seeing an increase in hospitalized patients with COVID-19. Again, as you've heard, and I think is really important to reiterate, if you're not already vaccinated, please do so. We have access in our vaccine clinics. This significantly helps prevent people from being hospitalized if they do get COVID. Many of our skilled nursing facilities are also struggling to accept patients once they are ready for discharge from the hospital. They're experiencing staffing challenges along with the rest of us. And that means patients are staying in the hospital longer than they would normally. We're working with our nursing home partners closely to see how we can help, as well as working with patients' families to support them in bringing their loved ones home with additional help through services like St. Luke's Home Care. We've also been experiencing some staffing challenges. I know we heard that from Dr. Bastin DeYoung and Dr. Stephen, and we know that our partners throughout the region are also experiencing this. Some may wonder if our COVID vaccine policy contributed to that. And the fact is that it really didn't. We had less than 1% of our employees leave because of our vaccine policy. And again, I think the important thing to note there is that policy was about keeping our patients, many of them in their most vulnerable position, safe. A higher percentage than usual of our retirement age employees chose to retire during the past year and a half. And some of our employees have opted to become travelers in hospitals across the country. While labor markets remain tight, we are working incredibly hard to retain our great employees and recruit more. We urge people who are sick to seek care in the most appropriate setting. Again, we are safe and we know how to manage COVID-19, and we hope you'll seek care when you need it. And with that, I'll turn it back to Tony.
Thanks, Dr. Van Deelen. And I think that concludes our speakers, so we can go to some question and answers. Just a quick note on that. I said at the beginning of this that we could use the raise your hand function in Zoom. I'm thinking we're having a couple glitches with that, so we might not see your question if you use that function. So I think it might be best to just type your question in the chat, and then I'll read it and we'll get an answer for your question. Just a reminder, if you could please put your name in there along with the media outlet you're with, and to whom that question is directed, that would be great. I think our first question comes from Kendall Jarbo at KBJR and CBS. Her question is, the nation is seeing a decrease in COVID-19 cases, but that's not the case in St. Louis County. What do you think? Why do you think that there is a difference, and what's the reason for the delay?
Am I on mute? I guess I am. Well, I guess. Go ahead, John.
You know, I think I can tackle that initially, and please anybody else pipe in if they have additional insight. It is true that nationwide we're starting to see the downslide of this current surge, but that we are not seeing that in the Northland, nor are we seeing it statewide. So Minnesota is currently one of the top 5 states seeing increases in COVID-19 cases, whereas much of the rest of the country is starting to see decreases. Why that is a great question. I don't think we fully know the answer to that. In part, it's just the nature of how a virus will work its way through the community. So as we've already seen during this pandemic, these different variants will kind of burn through the community in waves. And we're currently just kind of in the midst of our wave. And in other parts of the country, they kind of hit that peak of their wave a little bit earlier. And when you have fairly high vaccination rates and then a virus that is affecting the unvaccinated, at some point you receive a level of herd immunity where people have either been vaccinated or they've been infected, and therefore the virus has a more difficult time spreading. Here in the Northland and in the entire state, we just have not hit that point yet. Yeah. Which speaks to the importance of the things that particularly Dr. Bastin DeYoung spoke to about wearing a mask, whether you're vaccinated or not vaccinated, because that's helping to prevent the spread of this virus, which is causing our surge to persist.
And I would agree that if you look at this historically, even at the beginning, our numbers weren't high the first place in the country. I mean, it started in other pockets. And so it's different waves at different times in different parts of the country. Also, I also heard when I was listening to news reports nationally of schools opening sooner than our schools opened in this county. So even maybe, several weeks sooner. There's some schools that start 4 to 6 weeks before we do. Our local schools didn't start until September. And that definitely makes a big difference as far as transmission in the community. I see there's a question from Jesse White, Mesabi Tribune, saying what number of patients do we have that are in the hospital that have COVID positive, and what number of those are unvaccinated? And we do have approximately at our hospital, well, I know the numbers overall are 129 hospitalized with COVID-19 across Essentia. So across all of our hospitals, approximately 25 COVID positive patients are in an ICU situation. Of those, 5 were vaccinated, and we have 19 COVID patients on ventilators with 4 of those vaccinated. And some of those patients are not in the hospital because they have COVID. They are in the hospital because they've had a heart attack or they've had some other type of kidney failure. And they just happen to also be COVID positive. We have a situation where a very, very ill patient with cancer who unfortunately, due to a poor immune system, did get COVID, but we feel that was the vaccination that actually saved that person. That answers your question.
Then going back to the question about why are we delayed, there's also the fact that the Delta variant is actually hitting us later. So it was down in the southern states for many months, and that's why, and we did not get it up here at the same time. And then as it has gone through, it's hit our northern states now, and they've already gotten some immunity to it down in the southern states. And so that's why we're seeing that delay.
Thank you. Next question comes from Laura Butterbraun at the Duluth News Tribune. Her question is directed to anyone that feels qualified to answer it. Are there any numbers for how many Northland patients are being diverted to hospitals outside of the region? Maybe we can get a St. Luke's and Essentia perspective on that one.
Yeah, I don't have a specific number to that. I can tell you that we work very closely with our critical access partners throughout the region to try and avoid diverting the vast majority of patients. And in most respects, we've been successful with that. So I would say it's single-digit percentages and probably low single-digit percentages.
I would echo that. We have 8 hospital, or actually 9 if we include as far over as Brainerd Lakes hospital facilities for Essentia that we consider to be regional. And we are definitely leveraging every hospital's capability to care for our patients, and have recently done a very close study as to kind of med-surg patient go to, say, a hospital bed in Moose Lake versus having to go to a hospital in Duluth or Virginia. I would echo that very, very small number have had to go outside the region. Would you agree, Dr. Bastin DeYoung?
No, we do get calls from, so hospitals within our region. We work very, very hard to try and get those patients here as soon as possible, especially the critically ill patients. So we try to triage just as you do in the emergency room or other places. And the sicker that patient is, the more we try to get them here. As far as how many have gone out, I would say it's probably, just like Dr. Van Deelen was saying, probably less than, like, around single digits, because we're in constant discussion with those hospitals. We're managing them with the doctors there and our ICU doctors, and we're talking and saying, okay, let's do this first, this next, and then let's get them here. And we have discussions with our emergency room to try and get them at least into our facility and then a bed available as soon as possible.
I would echo, in fact, C4, the Critical Care Coordination Center for the state, they are tracking these numbers. And a couple of weeks ago, they did kind of a brief little study where they looked at the number of patients statewide who have had to shelter in place. In other words, those patients at a smaller hospital who weren't able to be transferred to a larger hospital. And they did it by region of the state, and the Northeast region of the state was significantly lower than any other part of the state with regard to the percentage of patients requiring shelter in place. So in other words, in our region, we've been more efficient and effective at moving patients out of our smaller critical access hospitals and into our larger hospitals than have other parts of the state.
Thank you. Next question is from Renee at WDIO. Again, to anyone who feels qualified to answer, would you say the treatments for COVID-19 are helping your teams in the ICU and making it easier than this time last year?
So the main treatment that's been proven over and over again is really steroids, and that absolutely makes a huge difference to these patients that have ARDS in the ICU, which is the complication that comes with COVID pneumonia when the lungs are filled with inflammation, and that's why they go on to ventilators or life supportive machines. And so that does make a difference. Other medications that are under emergency use authorization have had many studies now, and some of them show a little bit more help during the beginning of the disease. So coming in early, getting an antibody, a monoclonal antibody, if you're eligible, is key, because I think that has actually kept people out of the hospital and out of the ICU. And then other treatments like remdesivir, that may help early on, but less so when you're already very sick in the ICU. There are some other treatments that we're using in the ICU, which again are under emergency use authorization, but none of them are as proven as the vaccination. And so it's very hard when someone comes in and says, I wish I would have gotten vaccinated, I'll take whatever you have. And, at that point, it's a little bit too late for them. So vaccinations are proven, they're FDA approved. People should be getting them first, because that's really our only proven treatment for this at this point.
Yeah, I would just add, this really is a success story. If you look at our COVID hospitalizations, or certainly deaths related to COVID and ICU hospitalizations in this surge compared to our highest surge last fall, it's a totally different environment. We're definitely seeing a surge, and we're all feeling that in our hospitals, but it really is a credit to the advances that have been made in treatment and the availability. Remember, early on, we were limited in who could get the vaccine. We didn't really have any options for treatment, and we really have good options now. Our monoclonal antibody clinic has been really busy, and that's great because people are getting treated early in their illness, which keeps them from progressing. As Dr. Bastin DeYoung said, the number one tool is the vaccine. It's available, it's safe, it's effective. So again, if you haven't availed yourself of the vaccine, please do that. But the care in our hospitals has advanced, and people are doing better because of it. So again, as I look at this, I feel like we are in a better place than we were a year ago. So that's a lot to be thankful for.
I see a question in the chat from Chelsea from the Brainerd Dispatch. A question for anyone. Have you ever in your career experienced this number of patients in intensive care or emergency departments for the same disease or anything comparable? I entered medical school in 1982, so that's a 40-year exposure through medical school, residency, and 32 and a half years here practicing in Duluth. And I have never seen this degree, this number of patients. This is a lifetime, I'm hoping a once in a lifetime experience to see this type of unprecedented number of patients with the same disease in the ED. I've also been around long enough to see the incredible result of vaccinating children for meningitis. When I was a resident, we did spinal taps not once a week, not twice a week, multiple times a week on children, especially babies and toddlers. And they had two types of meningitis for which vaccines came out in the late 80s, early 90s. Now, almost never. I may have one baby get a spinal tap because they have a fever, and it's not those diseases. So it's been phenomenal change just in my lifetime to see the results of vaccines and how effective they've been. Thank you.
Yeah, I'll just jump in because I suspect I'm near Dr. Stephen. I've been in hospital since 1988, and there is nothing that I've seen in my career or even heard of from some of my mentors. And again, it speaks to the historical nature of this pandemic. This is truly a once in a generation pandemic. It is not just influenza. Influenza can be really bad. And we have all, I think every one of us on this panel has experienced really bad seasonal influenza seasons where the disease has been particularly deadly. And none of those seasons has come close to what this has been with COVID-19. So this is a real dangerous illness that we have great treatments for. We just need to use them.
I'll piggyback on that. So I started med school in '99, so a little bit after you guys. But when the last time I experienced something like this was in 2010 when we had the H1N1 flu. We had 42 patients intubated during that time. Very, very busy. The difference is now that because of technologies, we can keep people on very, very high flow oxygen. So there's less people intubated with the COVID, but there's many more patients with it requiring high flow oxygen. So less intubated, but a ton more patients that are actually in the ICUs and in the intermediate care units and on the floors with high flow oxygen with COVID. So we've never experienced anything like this before. However, it does make me concerned for the future because that was 10 years ago, a very severe respiratory disease. Here's 10 years later. So I do think we need to, just really stay vigilant, keep our vaccinations up, and then, just really look to the future for how do we prevent this in the future.
I'm not seeing any more questions in the chat. Maybe we'll give folks just a minute or two here to get out any more last minute questions before we wrap up here. So if you've got a question, here comes one. Renee from WDIO again. Would you say that recovery percentages are better with treatments?
Maybe clarification, better than they were early on in the pandemic. Obviously treatment helps you recover better. I guess I'll let our intensivists respond how they would choose to.
Yeah, so absolutely. So I think that, the course of the disease, it takes its course, but people can recover from it. We know the disease better. We know how long that it takes to recover from it. It is much longer than any other viral pneumonia with ARDS that we've had before. And that's what we needed to know, and the inflammation that it creates is much worse. But with treatments, people are recovering from it. The hard part is that now there's much younger people getting it and they are recovering from it. But at the end of it, there's many people who are ending up with a scarred lung disease. We call it fibrosis. And then they live with that after this disease. So a scarring of the lungs is what's happening, but people are recovering from it with the treatments.
And I would add in that, the treatments we have now are also more effective in keeping people out of the hospital. And so in those high-risk patients with COVID-19, when they receive the monoclonal antibody infusion treatment, we know from the data that in high-risk individuals who receive monoclonal antibodies, their risk of requiring hospitalization decreases from 10% down to 3%. So a 7% decrease in the need for hospitalization in high-risk patients if they are diagnosed early and receive monoclonal antibody therapies. But those therapies are only indicated in a certain time window after you become infected. And so once you get 8 or 10 days out from your symptoms, those medicines are no longer helpful, nor are they indicated. And so, rapid diagnosis, particularly if you're high risk, and then rapid treatment is important to prevent these hospitalizations that are stressing our system so much.
We have one more question from Jesse at the Misabi Daily News. Her question is, and I'm not sure if anyone has this off the top of their head, what is the vaccination rate in St. Louis County and Minnesota? Since you wrote that question, Jesse, I did check a couple dashboards, and it looks like it's 58% fully vaccinated in St. Louis County, and then about 57% in the state. I don't know if anyone has different numbers in that, but that's what I'm seeing on a couple dashboards online.
Now we would go to the Minnesota Department of Health for that information, which I suspect is what you looked at.
Yeah, that's correct.
Yeah, it just depends on the age that you're looking at and whether it's a completed vaccination series or not. If we look at St. Louis County, and I just know because I looked at it this morning, folks 65 and up, we're very good. I think it's mid 90% range. And that's at least one dose of a vaccine. If you go 16 and above, it drops down to, I think, about 66%. So all that being said, that's really good. If you look at comparing us to many parts of the country, which again, I think speaks to the fact that the surge isn't, it's big, but it's more prolonged and plateaued. And part of that, I think, is that certain parts of our population are really well protected. The long story short, there's a lot of folks that could really benefit from a vaccination and should still take advantage of it.
And then there are people, if you look at newborn babies and 1-year-olds and 5-year-olds and anyone under 12, 100% of them are not vaccinated. So it's really important to keep them safe by getting the vaccine when you are old enough to get it.
Not seeing any more questions again. Maybe again, we'll just give people 1 or 2 minutes here to get a last minute question in. We're at the bottom of the barrel in the chat. So we'll just hold tight for a minute or two to see if people are going to type another question in there.
Just want to use this opportunity to express my gratitude for the team that I work with, the team that Dr. Bastian Jiang leads over at the hospital, the people who on the front line are fatigued and sometimes in some despair to continue to see ill patients coming into the emergency department and coming into the ICUs. So I can't tell you what a wonderful group of people are staying here to care for our patients in our community and to care for each other and to help them get through this. We are here when you need us, and we'll hope that you stay well and won't have to come to our emergency department. Our ambulatory, so our outpatient clinics, are also working hard to be sure to find ways that they can keep people from not having to come to the hospital and the ED as much as possible. If you aren't sure what you need 24 hours a day, you can go online and you can get a virtual visit on demand and talk to a healthcare provider anytime.
Yeah, it's a great point. I would just add, if you know somebody who works in a hospital or a clinic, thank them, right? Early on in the pandemic, we recognized just the heroic efforts of our healthcare workers. And now, approaching 2 years in this pandemic, there is a lot of fatigue, and it's hard. It's hard to have seen the level of sickness and the level of loss for that period of time for our frontline workers. So if you know a nurse, if you know a person who cleans in the hospital, a pharmacist, a medical assistant, just thank them for the work they're doing, because it's really, really important that they feel the support of our community. And we've been really great at that, but it's probably more important now than ever.
I'm not seeing any more questions, so I think we can wrap this up. A big thanks to all of the participants in today's news conference. We appreciate you taking time out of your busy day to spend an hour or so with people and kind of update them on the status of how things are going in our communities and whatnot. A big thanks to all the reporters who participated in this and are going to be busy putting together stories now for their 5 and 6 o'clock newscasts. We appreciate your time as well. Just a reminder, this was recorded on our end, so if you run into any issues with your recordings, feel free to reach out to us and ask for a copy of it. Just a reminder, if you're looking for something specifically as far as follow-up questions are concerned from St. Luke's, I direct you to Melissa Berlaga to ask those questions, and if you have questions specifically for Essentia Health, you can direct those to me, and I think most of you should have that contact information on your file. Again, thanks to everyone for participating, and I hope you have a good rest of your day and a good rest of your week.